of age, I don't think, and especially because you've already had the carotid surgery once, correct?
Yes.
Yeah. With having the carotid surgery once and at 92 years of age, I don't necessarily think it would be a good idea to undergo or try to undergo that surgery, because there's a good chance that it would probably come back fairly quickly. But even there's really no true indication, especially if you're asymptomatic and you're not necessarily having, say, dizziness, lightheadedness, or any other increased chances of having a stroke. So if you're really not having any of those symptoms, there's not really an indication to do the surgery. But with the redundancy of the blood flow, there's always going to be some perfusion to the brain. Now, the right carotid artery is at 60%, so I mean you still have adequate blood flow through that. You've got adequate blood flow through the vertebral arteries. That left side, I mean, over time, I mean, it could completely occlude, but you still will have redundant circulation to the brain. And a lot of that has to do with just the pure anatomical structure of how the vascular system works through the neck and to the brain. So I don't disagree with not really aggressively pursuing that surgery. I do think it's probably in your best interest to not undergo another surgical procedure like that. There is a chance it's called a carotid endarterectomy. There is a chance that people can have ischemic strokes during that procedure, because what typically happens is they do, and especially if it's bilateral, which they rarely ever do bilateral, but they do the surgery, you do kind of cut off a little bit of the blood supply. Now, the procedure's definitely gotten a lot safer than it was in the past, but I think at your age, it would not be beneficial to do the surgery.
So is there anything medically that we could do to decrease the possibility of her having a stroke? Because she has been experiencing confusion, lightheadedness, headaches. I know not that often, but you have complained in the past few months about having one and feeling lightheaded and feeling, like she's kind of dizzy.
Yeah. So in this case, if there's not a viable option for surgery or any kind of intervention, what you really do is you aggressively manage the risk factors. And in her case, the two biggest risk factors are blood pressure and cholesterol. So what you want to do is you want to keep the blood pressure controlled pretty much all the time. You want to keep it as controlled as you possibly can. The goal blood pressure would be 130 over 80, and hers is 138 over 66, which is good. As long as it stays right around there, that's great. So you're keeping the blood pressure well controlled. Now, the other thing, keeping the cholesterol control, she's on atorvastatin 80 milligrams, which is the max dose on that medicine. That's the most you can take per day. And let me pull the last cholesterol panel up real quick. The last cholesterol panel we had, which was in May, it didn't look that good. The total cholesterol was 249. The triglycerides were 211. Both of those numbers are elevated. Her good cholesterol was 59, which is good, but the LDL cholesterol was 152, which is definitely considered elevated if you have carotid artery disease, as well as having other risk factors like hypertension, as well as chronic kidney disease, which we know that she's got that. Let me see what the first cholesterol panel we had looks like. Actually, the first one looked pretty bad. Total cholesterol was even higher. It was 278, and the triglycerides were 675. And her LDL at that time was so high that it wouldn't even read on the reading. So, the Vascepa is good, but so the atorvastatin 80 milligrams is maxed out. The Vascepa is also good for the cholesterol. There are adjunctive medicines you can add on, like fenofibrates or what's called Zetia, to try to decrease that cholesterol even further. There are some new medicines to really decrease the cholesterol, but it's really difficult to get people's insurance to pay for them, and they're subcutaneous injections that you do once every 2 weeks. So I think the best route, because typically, you know, if we were really aggressively trying to get that controlled as well as possible, and you were amenable, you were okay with taking another medicine, then I would say, yeah, you probably need to be on some Zetia to help control that cholesterol a little bit better.
Well, let's think on that. I tell you what, is it possible for us, do you think we need to just make an appointment so she can come in and get her cholesterol and everything done right now? And then that way we can make the decision.
Well, you know, what we could do, if we were going to just draw labs, I mean, she wouldn't necessarily have to have an appointment. Y'all could just show up one morning and we could do fasting labs on her. But if y'all want to try to make an appointment early in the morning so we can do the labs as well, yeah, I mean, I'd definitely be glad to see her. I mean, whatever works best for y'all.
Okay, I tell you
but
what,
I do think, you know, go ahead.
I was going to say, I would want to just go ahead right now and get her blood work done. And then let you look at that, and then we'll schedule an appointment after you get the blood work done. And then that way we can make a decision there to, if we want to pump up the cholesterol and see if we can get it under control.
Yeah, I think that's a good plan. I think, you know, y'all can just stop by one morning, whenever works best for y'all, and we can do the fasting labs, and I'll see what her cholesterol looks like. Of course, we'll check everything. We'll see what the kidney functions look like in comparison to the previous labs. But the main thing is that cholesterol, because the LDL being at 152, honestly, that's about double. Actually, that's more than double than what the goal LDL is whenever you have carotid artery disease, chronic kidney disease, high blood pressure. You know, the goal number we're looking for is a 70 or less.
Okay.
So there's a very high likelihood that, you know, if you were amenable to taking another medicine, then I'd say, yeah, we need to put you on Zetia to kind of help get that cholesterol a little bit better controlled.
Now, what are the names of the medications that you were saying, the subcutaneous kind? Because I would love to be able to research it and see if the insurance will pay for it.
Yeah, one of them is called Repatha. That's Repatha. And the second one is called Praluent. Praluent.
Okay. I'm going to check with her providers and do that. But what I'll do is next week when I have my appointment, I'll just bring Mama with me and then get the blood work done, and then we'll go from there. And then I'll schedule an appointment while we're there for talking to you after that. How about that?
Hey, that sounds good.
Sound like a plan, Mama? Okay, she said, yeah, it sounds like a plan to her. So we appreciate you.
Yes, we do.
All right. Hey, does she need any refills on medicines right now?
I told the nurse that we need everything refilled because I know I did the last one on the amlodipine, so everything probably just needs to be sent in.
Okay. Does she need a refill on the nausea medicine too, or is she okay with that?
Yeah, on the promethazine, yes. She just got the ondansetron refill, so Dr. Garrett sent in a prescription for that. But the promethazine, yes.
All right. I'll go ahead and send in. Is she still using the same pharmacy?
Yeah, CVS.
Okay. I'll go ahead and refill all those medications, and just bring her along with you whenever you come in. We'll get her lab work. We'll see what that cholesterol looks like, and we'll kind of go from there.
Okay, great. Thank you so much.
Thank you.
Mama, you going to tell him thank you?
Hey, you're welcome.
Thank you. We'll talk to you later.
You're very welcome.
All right, you have a good day.
All right, y'all have a good one.
Okay, bye-bye. Okay.